Hey there, it's Dr. Brian McKay, Core Health and Darien. I want to talk to you about 6 weeks to a better back program. Now, is your back going to get 100% healed in 6 weeks? Hopefully. However, this beginning of the new year, new ideas, new goals, and new different plans for what we want to do, how we want to change our bodies. If you've had a long-term back issue, a chronic back issue, something lasting more than 6 to 9 months, if you don't think you have to do exercises, then just hang up now. Don't bother listening. The only way you're going to get true lasting relief for your back problem is to exercise. And if you were to go to the gym and you have a bad back, and you start with lifting weights, doing the treadmill, doing all kinds of good stuff, there's nothing wrong with going to the gym. But if you have an underlying condition, you must understand, fix that underlying condition, because it will work against you and will work against you obtaining your goals of one, being in better shape, hopefully, but two, also not having a bad back. A back is a mechanical wonder. It's put together incredibly. As we are living longer, we are putting more stress onto our backs, but we're also sitting way, way, way too much. Think about it. Let's say pre-pandemic. You sit in your car, you drive to the train, you sit on the train, you go to your office, you sit at your desk, you go out to lunch, you sit at lunch, you come back, you sit at your desk, go back to work, leave work, sit on the train, get back into your car, go home, sit down, have dinner, sit down, watch TV. Well, it doesn't work that way. It maybe when you're in your 20s, but you're probably not sitting anywhere near as much in your 30s, 40s, 50s, and 60s, and even later in life than you are when you're in your 20s. So things just start to change. If you're getting older, your back needs some tender, loving care. And some basic exercises is where you need to start. And basic exercise, I'm talking about the first week or two, stretches. Do a stretch. Now, if you're going to do this with starting an exercise program, the exercise program's got to start out light anyhow. Maybe you're deciding you're going to get a Peloton. Add these stretches in. They're just very simple, easy to follow along with. They're going to get to you either in an email or they're going to come to you on your phone. Look at them. They're very, very simple, self-explanatory. But it's a kind of a way to wake your body up. If you think you can go out and run 10 miles and you haven't run in 6 months, it's not going to happen. There's going to be a price to pay. And if you think you're going to go start healing your back by going to do the Peloton, getting on a treadmill, doing elliptical or anything, it's usually ripe for failure, and we don't want that. So understand the underlying problem needs to be addressed. Like if you're failing in Spanish and you're getting an A in English and Latin or history, you still got to address that failing. That failing class has to get addressed. And if your back is failing, you need to address it. So what this program does is a 6-week wake-up call for your back. It's part of a program called the Back Pain Project. Now, what is the Back Pain Project? Funny you should ask. I'm going to tell you. The Back Pain Project is a program we put together here at Core Health to help chronic low back pain sufferers get the relief they need. Now, I happen to be a chiropractor, and everybody's got their opinion. Chiropractors do this, chiropractors are wonderful, chiropractors suck. All the whole gamut of what chiropractors can and can't do. If you just want a little back relief, chiropractic adjustment can deliver. Do you want it to last? You got to do some exercises. I liken it to that, like say your car was in an accident. You get the car, it's banged up, you go bring it to the body shop, they fix it up, but there's some structural damage. Maybe the undercarriage isn't, the wheels aren't balanced. Well, you don't fix that, you're still going to have problems with the car. It's never going to be 100%. So you got to, I'm stressing, you have to understand that the back underlying problem needs to be worked out first. Starting with stretching, progressing to certain exercises. And you don't need equipment to do the exercise that we're going to be sending you. Once a week, every Monday, you're going to get a new set of exercises, and you're going to add to the ones you already have. And we're not talking about hours of exercise. We're talking about by the time you're done, you're you're going to have about a 20-minute protocol that you can follow to start healing your back. And that's whether or not you come see me as a chiropractic patient or not. But as it relates to the back pain program, there are so many new therapies that, one, most insurance companies don't cover because they're so new, or they're not tried, true, and tested for 25 years before they'll agree to pay it. Let's face it, the insurance company's job is not, they don't want to pay bills. They fight tooth and nail. I mean, one thing that we have great results with is cold laser. Cold laser fires up the cells. If you can understand photosynthesis and how plants grow, well, that's how your cells, and we're talking about muscle cells, skeletal muscle cells, how they function is you get the thing, you help produce energy on the cellular level when you use cold laser. And cold laser helps produce ATP, which is the muscle fuel inside the cell. So what happens is you have these organelles called mitochondria, and inside the mitochondria, you get production of ATP. The light energy from the laser helps produce more ATP to give the cells, the muscle cells, fuel to operate on. Okay? Very, very important. Now, of course, you need glycogen, which is muscle fuel, to get into the cell, but then you need the ATP to transport it and convert it into energy. So try to understand, laser is a very effective way, and you go anywhere, laser's not covered. I mean, people doing laser on horses, they're doing it on dogs, cats. Laser's been around in Europe for many years. That is one of the particular things that we do within the back pain project here at Core Health. On top of that, we have a program called spinal decompression. Now, spinal decompression, personally, I've been doing it for about 22, 23 years now. And the next generation, the fifth generation of decompression machines are out, and they are phenomenal. They open up the joint space between the vertebra where the nerve gets pinched. So when that nerve gets pinched, how do you unpinch it? Well, you start out with the chiropractic adjustment. Now, everybody's got these different ideas. The chiropractic adjustment puts things back in a better location. So what I'm saying is, if you have, let's go back to the car analogy. You have four tires. Hopefully, you got four tires. And one's got 22 pounds of pressure, and the other one's got, the three have 40. That 22 pounds of pressure is going to affect the front end, going to affect your alignment. It's going to affect the way the car drives, especially at higher speeds. So what happens is balance it out. So tell me about the chiropractic adjustment to balance out the structural aspect, because when you alter the structure of your skeletal system, you're going to alter the way it functions. Now, typically, if you didn't have all these muscles attached to these bones, it wouldn't be a problem that the structure's off a little bit, but they are. They're all attached. So when a muscle goes into spasm, it could be overuse, disuse, but if you have the muscle attached in a proper or as good a location as possible, that is not extra stresses placed on the muscle, you can heal it. So you have to address the muscles. Now, what other methods do we use to address the muscles? Cupping. Cupping is an acupuncture technique where you put these cups over the affected muscles, and it draws out the lactic acid. Now, when glycogen, which is the muscle fuel that gets into the cell, converted in the mitochondria along with the ATP into energy for the cell, what happens is a byproduct. It's called lactic acid. Lactic acid pools in muscles that are overworked. If you want to get a feel for what lactic acid is like, have someone grab a hold of the back of your neck or your traps and squeeze at the end of a long day. Does that feel good? Yeah, that's lactic acid. So the cupping will pull and draw that out of the system, making the muscle more efficient. Okay, it's kind of like changing the oil. The oil gets gunked up, you change it, it becomes much more efficient. And so far we've named laser, we've named cupping, and we've named spinal decompression. But I want to talk a little bit more about spinal decompression. Spinal decompression will allow the fluid that takes out inflammation, because if you have pain, you also have inflammation. And with the it's called cerebrospinal fluid. This would be the same fluid they take for spinal tap when they analyze to see if you have different conditions, within an infection within the spinal column itself. Very important. It's a soothing. It creates a barrier. Okay, you have it up in your head. So when you have a concussion, cerebrospinal fluid helps. It acts as another cushion as well up there. So it's not just so much cushioning in the brain, but the cerebrospinal goes from your brain all the way down to your lower back. And if the pelvis is misaligned, it's going to interrupt the normal flow of that, which will then lead more likely to you having inflammation along with the pain. You cannot really feel inflammation, but you can feel pain. And if you have pain, invariably you will have inflammation. So we need to address that. And spinal decompression opens up the joint space. Another way to look at it is, hopefully you brush your teeth tonight or tomorrow morning. When you're squeezing the toothpaste onto the toothbrush, there's a little bit sticking out at the end. As soon as you take the pressure off the tube, that little bit of toothpaste goes back into the tube. What spinal decompression does, it creates negative pressure within the disc space. So if you have a disc that's desiccated or dried out because it has too much pressure from the bones, either the spinal bones or the pelvic bones being misaligned, this will, once you do the chiropractic adjustment and put that bone to a better location, you follow it up with spinal decompression. Spinal decompression will allow the fluid to come in, rehydrate the disc. Next time you go away, put 2 sponges on a sink. Leave one when you come back, wet one, you see it pops up. That is what spinal decompression does for your discs in your back. And so if you have bulging discs or you have herniated discs, more of a reason. And if you have a chronic back condition, you're more likely to have disc issues. So what have we named so far? First of all, the chiropractic treatment, very important to realign the structure and take pressure off the discs and the nerves. You have cupping, you have laser, spinal decompression. If I mention that twice, shoot me. Now, where do exercise fit in? You can't do all of this in one visit. So when someone comes in to see us, we have a whole course of action as far as home exercises that you need to do. Now, it does take some time to get people better within the back pain project. The best way to start is by doing the back exercises, which is why we have instituted the 6 weeks to a better back program. If you're going to go to a physical therapist, do these exercises first, because if you go there and you're spending 6 to 8 weeks, which is probably all your insurance is going to allow you to go for, you do these exercises first, you're warming up the body. You're getting the body more ready to accept the care you can get. And listen, if you got a chronic bad back, go see a physical therapist. Go see a chiropractor. The medical doctor is not going to do much more than say either go for an MRI, take this pill, take this shot, maybe even you need surgery. They don't really know how to treat a mechanical issue. Chiropractors and physical therapists are both trained to treat more on the mechanical level. So understand there's a mechanical you, all the sitting that we do, lack of exercise, standard American diet is another issue we're not going to get into today. But these are all steps you can take to start a program. But if you have a bad back and you want to start exercise on a regular basis, address the low back, fix it, give it every fighting chance so you can stay young and healthy. I mean, if you don't believe me, go up to Walmart and watch The Walking Dead. These people are walking around. You can see them. Their hips are moving in weird shapes and weird directions. They're hunched over. Getting in and out of a car is a hassle. Getting out of a chair is a hassle. Start with exercises. So what we do is, and believe me, you don't have to come see me at the back pain project. If you're interested, I'm more than happy to take a look at you. But start with exercise, no matter what you do. If you're going to start a new exercise program, be it a Peloton, a treadmill, cycling, walking, running, swimming, get the back working properly. Give it a fighting chance so it doesn't fail. Because if you got to take care of the basics, and you have to understand, unfortunately, you probably have to exercise the rest of your life. So if you're not into that, again, hang up. Put the you don't like this podcast. That's on you. I'm just telling you, it's a very good way to start. I'm more than happy to send these out to you once a week. There's going to be a link below. Click on it and sign yourself up. And every week on Monday for 6 weeks, you can get new exercises. Listen, I'm Dr. Brian McKay. Yes, I'm a chiropractor, but no, I don't just do chiropractic, which is why the podcast is called Not Just a Chiropractor for Stamford, Darien, Norwalk, New Canaan, the areas that I serve. I hope you found this to be informative. More than likely, just take me up on it. You never have to see me. You'll just get these exercises on a weekly basis. Click the link below, sign up for it. We'll see you soon. Have a great new year. Have a healthy, happy new year. And I hope you gain some benefit with your low back pain. Thanks for listening. I'm Dr. Brian McKay, Core Health in Darien, founder of the Back Pain Project. Questions, you want some answers? 203 656 3636. 203 656 3636. Thanks for listening. Have a great day.